What is rehab or rehabilitation? My name is Fred Bagares, a board-certified sports and spine medicine physician in Virginia Beach, Virginia. After 10 years of practice, I still find musculoskeletal medicine both fascinating and challenging. This podcast is about the lingering thoughts and questions I've had after residency and fellowship. My hope is to spark discussion, challenge dogma, and share my experiences in musculoskeletal medicine. Welcome to the Talking Rehab Podcast. In medical school, we are taught the importance of the physical examination, which for me includes observation and also testing, doing manual muscle testing, specialty tests for orthopedic conditions, things like that. But as I've gotten further into my practice, I started relying a lot on my observation. I still see people and do the standard muscle testing and the nerve testing, things like that. But I automatically start observing the patient as soon as they walk into my clinic. In my experience, watching them do that actually gives me the most amount of information. So I started paying more attention. I found that a lot of my focus was often not just how people walked, but their shoe wear and their feet. And essentially, I got sensitive to the fact that when people come in with slippers or untied shoes or signs of just general poor foot hygiene, for me, that is a really, really big red flag. And I'm sure everyone's going to wonder why. Why is that the case? So when someone comes in with poor essentially long nails, or they don't have lotion on their feet or on their legs, or they don't have shoelaces, or everything is really untied, they don't wear socks with their shoes, things like that. Some of that I can attribute to personal preference, and maybe just the style of how they want to wear their clothes. But from a medical standpoint, it tells me that this person is having difficulty reaching their feet. And that can be for a number of reasons. Perhaps they have back pain. Perhaps they have hip pain. Maybe they have extra tissue around their tummy and they just physically cannot get there. And that to me is very concerning, because when you break down what it takes for you to be able to touch your toes, from, let's say, a standing position, you have to have balance. You have to have positional awareness. You have to have trunk control. You have to be able to bend at the hips. And if you can't bend at the hips, you have to have really good range of motion while locking out your knees. And when people will have back pain, obviously one of the things that they fear is bending over, particularly with disc herniations or discogenic pain. It's a lot of pressure on the disc. And then on the flip side, if you do not have pain with flexion, people will often have pain going back up. So essentially going into extension from the flex position. So for any of the clinicians listening, we've all heard that story where someone went to go tie their shoes and then their back just kind of seized or locked up. And I find this a very common feature of facet-mediated pain. But, nevertheless, if it's painful, it's going to restrict people's motion. And when the back is involved, it can be very disabling and disruptive. Similar findings when it comes to like people's hips. Like if people have hip pain related to for a labral tear or hip arthritis, again, their gait will change. And when you think about if you're in a seated position, some people, the way they if they can't physically bring their body down to their feet, they will bring their feet to their waist. So essentially trying to like sit down, cross your legs in a figure four to put your shoes or put your socks and put your shoes on. And interestingly, that's a very common hip impingement maneuver. So the classic Faber testing position. And when people can't do that for one reason or another because they have intra-articular hip pathology, people will have a tendency to just, not do that position, and they'll just kind of like slip, flip-flops on, or they'll, if it's cold outside, they'll just put shoes on without socks. I remember I had one patient that, I think their strategy was essentially they just didn't really change their socks that often. So whenever I would see them, their socks were just really, really, really dirty. And essentially I was like, well, I guess, in my mind, I was like, I wonder how often they're actually changing them. And then I saw them like week after week, and I was like, I just don't think that they're changing their socks anymore. And so that's a problem. That's a big problem. Not just from like a hygiene standpoint, but that tells you the degree of pain and disability that this person is facing. Some people will just not even put laces in their shoes anymore because it just makes it that much easier just to put their shoes on. So I picked up on that early on in my career, but I find that it's a really very powerful sign. When someone comes in that way, you can almost guarantee that they have some sort of lower body or mid back issue. It's unusual, sometimes to see someone with like a shoulder problem and they have that same amount of difficulty. It's possible, but for the folks that have a hard time with just walking, bending at the waist and getting to their feet, I find that this is a really very powerful sign of disability. So I take it very seriously. Even in my clinic, I'll have people like, can you just show me how you put your shoes and your socks on? And it's very telling. I really enjoy watching how people create movement. So I'll in my new space, I have, some gym space. So I put my patients, you know, with, I give them certain tasks to complete so I can watch how they do things. And one of them is like, how do you get your shoes and your socks on? And it sounds really, really, mundane, but I think we definitely take that for granted. And so for any patients that are listening, it's, if you find yourself starting to have difficulty putting on your shoes for one reason or another, like that is that's a good time to maybe start talking to somebody, like your local physical therapist or chiropractor, a physician, and start working on your back. You could even just start doing some basic exercises that you can find online to essentially just see how you're able to move, because if that continues, it's kind of sneaky, but it can lead down kind of a long road of disability, and the recovery can take some time. I thought that this was kind of like an interesting finding, something to think about for you guys, as you start to monitor your patient's progress, start paying attention to, not just how they're walking, but, their shoes, their socks, the pattern of wear on their shoes, I think can also be super helpful. But kind of a different talk for today. I hope that you guys enjoy it. Thanks for listening. I'll see you next week. Thank you for listening to the Talking Rehab Podcast. I hope that this podcast stimulates you to question your own practice and how you approach rehabilitation. I truly appreciate your time and attention. If you enjoyed listening, make sure to like and subscribe to the podcast. I wish you a movement-filled day. Take care.